So let's talk about the tear trough deformity, or under eye hollowing or sunken appearance that makes you look tired, haggard despite having a good night's sleep. It is one of the most common concerns of patients seeking aesthetic treatments. But first, let's quickly talk about anatomy. So the skin under the eye is relatively delicate and thinner compared to the rest of the face. Number two is the orbital bone or the orbital rim, which defines the structure of the eye socket vis-a-vis tear trough. You also have to consider the muscle, orbicularis oculi muscle, which is responsible for blinking the eye, the opening and the closure of the eye. And then also the SOOF, the suboculars oculi fat pad that is located behind the muscle, which can also contribute to tear trough. And then there's also that ligament, the tear trough ligament, orbital retaining ligament, that can also influence the appearance of the tear trough. So tear trough also undergoes signs of aging as a result of mid-face volume loss, as in the case of your cheeks. That change alone can exacerbate the appearance of under eye hollowing. Aside from that, you are also noticing skin laxity as well as textural changes such as wrinkles. So given all of these age-related changes that are happening in the under eye, what are your treatment options? First is filler. However, not everyone qualifies for direct filler placement. Like I said earlier, if the cause is mid-face volume loss, most times when we address the cheek area, the middle and the lateral, it also self-corrects your tear trough deformity. When you press the under eye and it corrects, then you could be a good candidate. However, a lot of patients are not good candidates for tear trough fillers. So what can we do? Is your tear trough accompanied by laxity, textural issues? Because in that case, we can use energy device-based treatments such as radiofrequency microneedling. We also do PRF, plated wrist fibrin, which is your own blood, very high in growth factors, and we also inject that under the eye. I've had it done 2 years ago for myself. Sometimes I do RF microneedling. So when patients come here with that fat herniation alongside tear trough hollowing, your best procedure for that is to get a surgery, because that will give you the best bang for your buck. So come in for a consultation and see if any of these aesthetic treatments will be beneficial for your under eye. Book online at NANI.com.